When it comes to living with diabetes, it's not just about monitoring your blood sugar. Your feet need special attention as well. Even the smallest cut or blister can turn into something much more serious if it's not treated the right way, and that's why regular screenings and specialized care are so important. So today we are joined by Dr. McKee, who is here to share how diabetic patients can help keep their feet healthy and prevent further complication. Dr. McKee, thank you so much. We're so excited to host you. You got to help me out here. I don't know how these two worlds are connected, diabetes, foot care. I've heard of this connection before, but initially, what are some major problems that we see, and how are these related?
The biggest thing about diabetes in the foot is neuropathy. So a lot of patients that have diabetes can develop neuropathy, don't have to have diabetes to develop it, but it's the neuropathy that can really lead to problems because you can't feel pain, so you don't know when you have a small cut. You don't know if you have a corn or a callus because it's not hurting. Those can propagate into wounds or sores that then become infected and cause greater issues.
So is it a matter then of just checking on our feet?
It's as simple as foot inspection every day. Look between the toes, look on the tops of the toes, the sole of the foot. If you can't get your foot up and see it, or you don't have someone at home, get a small mirror that you can set on the floor and hold your foot over it, where you can inspect your foot daily, because between your doctor's visits is when the bad things are going to happen. And so you have to take the inspection as seriously as you possibly can, because that's what's going to keep you from getting into deep trouble.
Yeah, certainly. And we will mention that deep trouble just initially. Again, when we see wounds, ulcers, I mean, these can become very problematic if left untreated.
Well, wounds, which are really ulcers, can propagate, get larger, they can become infected. Sometimes that infection can get into the bone, and then once it gets into the bone, it's even harder to treat. And on occasion, that type of infection can lead to partial or full amputation. So it's very important.
Goodness, cannot imagine the things that you've seen throughout your career. We do want to stress though, so then if somebody were to see this kind of initial wound or something forming, can they just take initial care at home? Does it need immediate doctor treatment, or is it just Neosporin and a Band-Aid and we're fine to go?
The best thing is to go see your doctor, be it your family doctor, your endocrinologist who takes care of your diabetes, or a podiatrist, to make sure that it's really just a little corn or a little cut, that it's not something deeper. A lot of folks come in and say, I have this callus, for example, on the sole of the foot, and we'll shave off some of the dead skin and there will be the ulcer. It's already there. You didn't even know it was there. So it's better to be proactive than stall.
Sure. So again, monitoring that, checking your feet, your own inspection, and then of course keeping up with those doctor's appointments as well. Something else I want to talk about, Dr. McKee, I have heard kind of a connection of kind of tingling, nerve pain in the feet. How is that associated with diabetes?
Well, the tingling or nerve pain, stinging, tingling, burning, those are all the first signs of nerve problem, be it neuropathy, which is where the nerves are slowly dying, if you want to use that term, or you could even have something called tarsal tunnel, which is like carpal tunnel in the hand. The nerve coming into the foot can get entrapped, and you'll have the same symptoms as neuropathy, but different cause. So you need to find out which one are we treating, and then where's this going to go. Okay.
And again, we know that you see this in a lot of patients, I'm sure. I'm sure a lot of people with diabetes, again, struggle with this, but we're so grateful, and so grateful too for the work that you do. I think people, you know, foot health being its own category. I mean, you live your life on your feet, right? So I mean, it's a big passion.
I finally learned one day that your heart and your feet, without them, you don't go anywhere.
Yeah, truly. Well, Dr. McKee, we are so grateful for you. You're so knowledgeable and so personable as well. Tell us, if you will, again, where you are, for should people want to book an appointment, not just diabetes related, you treat all kinds of things. Where can we stay in the know?
We treat it.
Yeah, absolutely. So tell us where your office is.
We're at the Foot Clinic. I'm Dr. Jeff McKee. Our number is 384-6767.
All right, and you see that there on your screen. We'll certainly have that on tvliving.com. Dr. McKee, we love you. You're our favorite guy. We'll see you back in again soon for all future foot issues and what have you. So thank you. Appreciate it.